Hi there and welcome back. Let's review peripheral vascular disease, also known as peripheral arterial disease. Peripheral means outer limits and generally includes legs, arms, other organs, not heart or brain. Vascular means blood vessels and usually involves arteries, and that's why in some literature you will notice arterial, peripheral arterial disease or peripheral vascular disease, one and the same thing. Take a pause and think this way, that you are familiar with chest pain or angina. So what happens that in the arteries there is a reduced blood flow, and as a result one feels the chest pain that may start with ischemia, may lead to the infarction or the MI or the heart attack. Just like that, PVD or PAD, think this way, angina of the extremities or the lower extremities, or the atherosclerosis of lower extremities that causes ischemia, and as a result ultimately one feels the pain. Simple. So this can be either organic or it can be functional. And when we say organic peripheral vascular disease is caused by the blockage. Now that blockage could be caused by atherosclerosis. So recall the prior session that we discussed and correlate with that. So the process of atherosclerosis that leads to the blockage, and that is called organic peripheral vascular disease. And or it may also be blocked by emboli or the embolus. Okay, so that can again lead to the same category as organic peripheral vascular or peripheral arterial disease. The second one, the functional, is actually a short-term peripheral vascular disease like vasospasms. So what happens here is that the blood vessel constricts, changing the diameter, and as a result blood flow reduces. That causes the functional peripheral arterial disease or peripheral vascular disease. How about etiology? What are the causes? So as you all know about what causes the coronary artery disease, those are the same causes that leads to peripheral arterial or peripheral vascular disease. So to recap those, that would be increased age, hypertension, diabetes, elevated lipids, smoking, positive family history, and likewise obesity. Peripheral arterial disease is very popular in the legs. So you will notice less blood to the muscle tissue, that leads to less oxygen, meaning ischemia, meaning ultimate pain. So that's very common in the legs. So let's talk about the symptoms. Intermittent claudication, that is typical in the peripheral arterial disease. So what happens is it comes and goes, the pain. So that's why it's called intermittent claudication. You may have a painful itching, cramping feeling in the calf. It can also happen in the feet, thigh, buttocks, and especially when you are walking or exercising. Okay. The landmark or the hallmark of the symptom when it comes to peripheral arterial disease is the exercise-induced reversible ischemia. So as you exercise, you need more oxygen, but the blood flow doesn't circulate and there is a less supply than the demand. As a result, there is ischemia, but it is exercise induced reversible ischemia, meaning if a person stops, the pain goes away. So before we get into the diagnosis, what about the physical exam? So on physical exam, you would notice diminished pulse, or sometimes in severe cases, even that may be absent, no pulse. So you may palpate the popliteal area, dorsalis pedis pulse to feel for the same. Or while doing the physical exam on the legs or the feet, you would notice that legs or feet are cool, okay, because of the poor circulation. And in severe cases, you would notice ulcers on the physical examination. As far as the final diagnosis, the one and most popularly known is Brachial Index, ABI, and unfortunately in majority of the cases you may not even see this ABI in the medical records. So you need to correlate from the other info that you may see in the medical records. But ABI is the tool for the diagnosis. So what you do here is basically you measure the blood pressure in arm, then you measure the blood pressure in ankle, and then you take the ratio. So the systolic blood pressure in ankle over systolic blood pressure in the arm. If that is less than 0.9, then there is a positive diagnosis of peripheral arterial disease. And in different literature, they would categorize into the mild, moderate, or severe. Generally speaking, anything in the range of say 0.71 to 0.90 would be considered mild. 0.41 to 0.70 would be considered moderate, and likewise less than 0.40 would be considered severe. In addition to the ABI as a diagnostic tool, another tool that is also out there that has also been used, and that is Doppler ultrasound. So those are the two tools typically being used for the diagnosis of PAD or PVD. How about the treatment? Well, the doctor would start with risk factor modification. That's the first line of defense to treat. So, meaning if you are smoking, stop smoking. If you have any disease or conditions, say like hypertension or diabetes or elevated lipids, try to control your blood pressure, A1C, total cholesterol, overall lipid profile, the HDL, LDL, things like that. Another thing that doctor would recommend if someone has the PAD would be exercise, because exercise improves the blood circulation. Okay, so that's the first line of treatment as a general rule about the risk factor modification. The second line of treatment is the medications, and generally speaking, antiplatelet like aspirin or Plavix, for which another name is clopidogrel. Those are the medications being administered on as needed basis. And for the claudication relief, there is one popular called xylostazol. So that's another medication that may be given. And as far as the last but not least, the line of treatment goes, in severe cases, stent or some sort of surgical procedure that may be necessary. Okay, so how do we underwrite? First and foremost, follow the underwriting manual plus the company specifics. Second, an important aspect is make sure you are looking at the combo debits, because that may be overlooked, and especially so when you are on a hunt line and you get a call from one of our field partner. So make sure you are adding the combo debits before you say the tentative quote, subject to routine requirements, medical records, and yada yada yada. Okay, with that, suffice to say at the intro session, as far as the peripheral vascular or arterial disease goes, let's take a break here and see you soon. Take care. Bye now.